Imagine a hose that's 1 inch in diameter. Think how easily water flows through that large channel. Then imagine that there's a layer of gunk that coats the inside of that hose. Then add another layer and another. Soon the diameter of that hose is no longer its original 1 inch, but a half an inch. The layers of gunk have created a 50% blockage, making it more difficult for the same amount of water to flow through the hose. Now imagine that the hose is on a smaller scale, something like 1 to 2 millimeters. I'm not talking about an ordinary garden hose anymore. I'm talking about the arteries. That blockage creating gunk is cholesterol or plaque, and instead of your garden getting less water, it's your organs receiving less blood. Not a pretty picture, and it's one that interventional cardiologists or vascular surgeons like to fix when they see it. Most people know that this can occur in the coronary arteries, but narrowing blood vessels can happen throughout the entire body. It can also happen in the carotid artery in the neck or in the peripheral arteries in the abdomen, arms, and legs. One method vascular surgeons use to fix the blockage isn't by removing anything at all, but by adding a structure called a stent.
The way a stent would work is instead of doing an incision in the neck, we would place a catheter in the groin, and we would manipulate that catheter into the main artery in the abdomen, the aorta. We would work that up to the chest and then into the neck, and under fluoroscopy, which means continuous X-ray, we would locate the blockage and then open it up with a balloon and then place a stent in to try to make sure that the blockage doesn't come back. But we're not removing anything. We're just basically forcing the plaque open and compressing it up against the wall of the artery.
Stents are wire mesh tubes that hold the arteries open. They're usually made of surgical-grade stainless steel or other types of metallic alloys. Once in place, the tissue of the artery wall will grow over the stent. Though it sounds easy, stent placement is actually a marvel of modern surgical techniques. For example, winding a catheter through the vascular system without direct visual confirmation is tricky, and it's only possible thanks to talented interventionalists and some nifty technology.
When we do any kind of stent or any kind of non-invasive procedure to clean out an artery, we have to constantly see and view what we're doing, because one of the risks is that we could penetrate the artery and go through it, which would cause bleeding. So we're constantly monitoring what we're doing with fluoroscopy, which is a continuous X-ray, and that's not a drawback. The doctors that do the procedure wear special lead gowns so that they're not exposed, and for a patient to undergo the procedure one time is not an undue amount of radiation exposure, so that's not a drawback to the procedure.
Stent procedures are very popular. Nearly 1 million are implanted each year in the United States. Besides being an effective means of opening blockages, stent procedures are more convenient for the patient and less invasive than an open surgical procedure.
Well, most people would prefer not to have surgery, no matter what it takes. And in situations where the stents seem to work and to hold up, that makes sense. We do know, for example, that in some of the arteries in the legs, stents work very well. So in those areas, we would have no hesitation to recommend that procedure, especially over surgery, which tends to be much more invasive and much more debilitating. When I was a resident in training, everybody had to have a big operation where the abdomen was opened up, and it required at least a week or 10 days in the hospital. But today we can use a minimally invasive technique called a stent graft, and we can do the whole operation through either 1 or 2 small incisions in the groin. And instead of staying in the hospital for a week, patients usually go home the next day. So it's just a one-night stay in the hospital.
After the procedure, patients will have to take antiplatelet medications to prevent blood clots from building over the stent locations, but after a short period, this medication will be tapered off. Stitches aren't needed to close up the incision, so there's very minimal scarring, which no one will even see anyway because they're in your groin. So the only clue that you even had surgery is that you're feeling much better than you did before. Now, without chest pain and clear open arteries. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.